Shaheen.
Thank you, Mr. Chairman, and thank you all for being here. I want to make sure I understand some of the testimony earlier with respect to the TAP program. Mr. Rodriguez, I understand you to say that vets are attending TAP in record numbers. Was that correct?
Yes, it is. I'm talking about the DOL version of TAP, that one-day TAP course.
Okay, so that's a different TAP course than,
Well, it's a single day that's separate from the DOD and the Veterans Affairs days.
and how do you coordinate with what DOD is doing?
So we work seamlessly together as part of, it was mentioned, the TAP Executive Committee, the Joint Executive Committee. We work together to ensure that TAP is a seamless transfer of information and sharing of resources to better prepare that service member when they are preparing to transition out of the military.
So if I'm a service member, can I go to the DOL TAP rather than DOD TAP?
It's the same TAP. So there's 3 mandatory days, 1 day DOD, 1 day Department of Veterans Affairs, 1 day DOL, and then there's 2 additional optional days that a service member can take.
So what percentage are actually attending DOL's TAP?
I don't have the percentage, Senator, but I can tell you the numbers. Roughly 148,560 service members are going through the 1 day DOL TAP.
But I understood you to say, Mr. Sawyer, that 70% of members of the military who are getting out didn't attend. Are you talking about a different program?
Thank you. The 70% relates to those starting the program at least 1 year in advance of their transition date.
I can understand why veterans might be confused because the coordination is challenging. And as we heard from virtually all the chair and ranking members talked about the mental health challenges and the number of veterans who are at risk of suicide. And Mr. Is it Borsler? I understand that you've worked with our European allies about how they administer their transition assistance programs. Do veterans, non-U.S. veterans, face the same risk of suicide in their first year as U.S. veterans?
Senator, I'd have to take that question for the record because we don't, to understand their methodologies and how they measure that rate. But I do know that there are some great programs that our allies use as well as our own. I think we still have the best system.
And so are there, when you talk about those great programs, are there things that we should be adopting from what our allies are doing?
I do think that we, as I mentioned, Senator, we do have the best system when we compare to a lot of our allies in the way that they execute these programs. There are some interesting use cases, particularly in the United Kingdom and their career transition partnership. But in the intervening years, as Assistant Secretary Rodriguez mentioned, the ENPP program for the Department of Labor almost mirrors what the United Kingdom has been doing. It's been very successful. So I think there's a lot we can learn from each other.
I appreciate that. Mr. Jacobs, one of the things that we're hearing in New Hampshire is that too many veterans are not taking advantage of the VA benefits, particularly for mental health. It's the theme that everybody's referenced in all of the questions. So what can we do better?
Thank you very much for that question. We know that when veterans connect and access their earned benefits, whether it's disability compensation, home loans, education, or their VA health care, they have better health outcomes, they have better economic opportunities, and it decreases the risk for suicide.
Right. So how do we do that?
Correct. So we are aggressively continuing to do more outreach. So during the transition period, we're identifying where there are veterans, transitioning service members at risk, and providing a warm handover. We have benefits counselors, we have military service coordinators, there are VHA liaisons on military treatment facilities. Part of the way that we're doing that is through the Solid Start program, where we're calling transitioning service members 3 times in the first year after they leave the military at the 90, 180, and 365-day marks. And the goal of this program when it was created was to address the very real mental health concerns that we are all focused on. And the program is structured in a way where it's open-ended. So it's really tailored around responding to the veteran's needs. Do they need connection with a mental health counselor? and then we can connect them to a vet center, a CBOC, a medical center. Do they need a status update on their claim? Do they need assistance with their claim? Do they need help pursuing housing? And so we have opportunities like that, but it's also, to the point that was made earlier, it's Buddy Check Week. It's promoting opportunities for us, not only as a government, but as a broader society, to support one another, to know the signs to look out for, so that when we see a fellow veteran, a friend in crisis, that you know that there's a place to help them, even if you don't have the resources to do it yourself.
Thank you, Mr. Chairman.
Senator